Chairman, we are now live.
Thank you, Nikki. Welcome everyone to this virtual meeting of the External Services Select Committee at London Borough of Hillingdon. This virtual meeting is also being broadcast simultaneously on Council's YouTube channel, Hillingdon London. The purpose of this committee is to scrutinise public bodies outside the council that provide services to our residents. We undertake in-depth reviews and witness sessions on topics, submitting any findings to the decision-making cabinet. My name is Councillor Nick Denys and I'm the chairman of this committee. Just before we start, I'm going to just give you all some online housekeeping rules. Please can you ensure that your mobile phones are on silent, and if you have any home listening devices such as Alexa, they're turned off. Please could you keep your microphones on mute when you're not speaking and then unmute to speak. And as chairman, I will call on those to speak during the meeting. I'm on my iPad tonight, which means I can't see everyone necessarily. So sometimes Nikki will have to interject to tell me if somebody wants to speak and I can't see them. But if people can just raise their hands if they want to speak, and either I or Nikki should pick that up, that should be okay. In terms of technical meeting control, if any councillor leaves the virtual meeting partway through a period, e.g. loses connection, I'll continue the meeting unless we are not quorate, which is 5 councillors. If I happen to leave, then my vice chairman, Devi Radio, will take over. So just before we start the meeting, I'd like to do an attendance roll call just to confirm that everybody is here and also that their mics are working. So when I read out your name, could you please say present? Councillor Devi Radio.
Good evening, Chairman. I am present.
Good evening, Devi. Councillor Simon Arnold.
Good evening, Chairman. I too am present.
Good evening, Simon. Councillor Ray Graham.
Yes, I'm present, Chairman.
Thank you, Ray. Councillor Vanessa Hernahy.
Present, Chairman.
Hello, Vanessa. Councillor Stuart Mathers.
Good evening, everyone. I'm present.
Good evening. Councillor Ali Milani.
Evening, Chairman. Sorry, I was on mute.
Yeah, no, that's okay. That's okay. Councillor June Nelson.
Good evening, Chairman. I'm here.
Good evening, June. And for the first half of this meeting, we're going to be looking at the local vaccination programme. So we have the 3 witnesses for that session at the moment. So I'll just ask you to confirm that you're here as well. So Richard Ellis, Joint Lead Borough Director for Hillingdon Clinical Commissioning Group.
Good evening, Chairman. Yes, I'm present.
Thank you for joining us. Dr. Vino Suri, Chairman of the Hillingdon Local Medical Committee.
Good evening, Chairman. Yes, I'm present. Just to note, I'm the Vice Chairman for the Local Hillingdon Committee.
Well, yes, I wouldn't want to promote you outside your constitution. I'm sure one day I'll introduce you in this meeting as Chairman. But anyway, thank you for joining us. And Laura Tarling, External Affairs Manager. Oh no, sorry, she's coming next. She's the Post Office. Sandra Taylor, Director, Provider of Services and Commissioned Care, London Borough of Hillingdon.
Good evening, Chairman. Yes, I'm here.
Fantastic. I think that's everybody. If I've missed anybody out, please say. No, brilliant.
Chairman, I'm present.
Yes. Oh yes, sorry. Sorry, Nikki. Nikki, our committee secretary, is also present. Who is so pervasive, I've forgotten about you. So, but you're extremely important to this meeting. So thank you for reminding us. So first of all, we're going to go on to apologies for absence. Nikki, have we had any apologies for absence?
Chairman, there are no apologies for absence.
Thank you very much. Do any members have any declarations of interest in the matter before this meeting tonight? If no one says anything, then I will assume not. Brilliant. Item 3 is about the exclusion of press and public. All items in this meeting are public, so no exclusion of anybody. Right, item 4, to receive and agree the minutes of the meeting of the 12th of January 2021. Does anybody have any suggestions to change the minutes, or if nobody says anything, then I'll assume they're agreed. Okay, thank you. Yep, I assume they're agreed. And also to receive and agree the minutes of the meeting on the 14th of January 2021 as well. Again, if anybody wants to say anything to amend them, let me know. If not, I'll assume that they're agreed. Fantastic, thank you very much. Okay, we can move on to our first main agenda item, which is the local COVID vaccination update. So first of all, I'm going to ask Richard to give a bit of an update, then I'll ask Vino to give a bit of an update, then I'll ask Sandra to give a bit of an update, then we can go into questions. I suppose ultimately the most the thing that we're really interested in is what's happened to date, and maybe if our participants know of anything interesting happening in the future as well. So, Richard, would you like to start off?
Thank you very much, Chairman. Thank you. I will be brief. You have a paper in front of you, and I would welcome questions arising from it. But I will just say that the vaccination programme in Hillingdon has been running now since around the 3rd week of December, so little more than 6 or 7 weeks. And I think it represented a real light at the end of the tunnel for many of our community, offering the opportunity of a vaccine and protection. Since that time, we have been running vaccination sites in a number of sites across the borough. We are hoping to open more in the future, and we were given a specific target to meet by the end of this week of achieving 75% of coverage for 4 priority groups identified by the Department of Health, and these were residents in a care home with staff working in the care homes. Second, all those aged 80 and above, as well as frontline health and social care staff. Third were all those aged between 75 and 80. And fourth, all those aged between 70 and 75, and a group called clinically extremely vulnerable with particular health conditions. And I'm really pleased to say that we are well on track. I think we have already achieved the 75% target on each of those groups, but we are certainly well on target to achieve that by the weekend. Specifically, we believe that to date we have vaccinated 84% of the over 80s, 84% of the 70 to 74-year-olds, and 90% of those aged between 75 and 79, around 60% of clinically vulnerable patients, and a total of 73% of care home residents and staff. In fact, the proportion of care home residents is much higher than that. And we are well on the way to achieving probably 2/3, I think, of the health and social care workers. And I'd welcome any other questions about those proportions. You'll appreciate that there's a lot of different dimensions of that data. I think the only other thing that I wanted to say, Chairman, before asking Dr. Suri, or if there are any other questions from the panel, is really what a combined success the vaccination programme has been across the borough. This has been a real team effort from health and within health, from social care and with social care, with the voluntary sector, with the local authority right at the beginning in helping us identify sites and getting those set up so quickly, and also supporting with marshals and attendants to help the residents be seen quickly. So I think this is a real collective effort that everybody should be really proud of, and I hope that we can continue this success to date into the remaining priority groups. We're hoping that from next week we will be able to approach the 5th group, which is all those aged between 65 and 70, which we have already begun to make a start on, and in particular the large group, group 6, of adults aged between 16 and 65 in a particular clinical at-risk group. But I think I'd really like to stop talking now, Chairman, and I'd really welcome questions, and I'll try and answer them.
Thank you, Richard. I think we'll take an update from Dr. Suri and Sandra first before going to questions for everyone, but thank you very much for that update. Dr. Suri, would you like to give a quick update of your and other GPs' experience of the vaccine rollout?
Sure, thank you, Chairman. So I'd just like to say, overall, general practice has prioritised this as our get out clause for COVID, and GPs have been working very hard to ensure that the smooth running of booking patients in to the COVID sites and searching for patients that are eligible. We also get notified when patients that are eligible haven't booked or do not attend, and then we also call them to personally find out why. So that we're doing our absolute best to support the COVID vaccination program, and generally GPs are very glad actually and humbled by the way the COVID program has been rolled out in Hillingdon. Speaking to colleagues in other boroughs, Hillingdon has actually shone a light in terms of how quickly the vaccine can be deployed and how smoothly running the two sites are working. So I work in practice in the south of the borough. The right side, which has been established for a long time, has been very well coordinated, and there are many slots on the daily basis for patients into. It's similar for the Hayes site, which is a little bit newer in terms of its long function, and there seems to be availability of the vaccine rather than actual issues with deployment, and particularly as our patients are receiving the Pfizer vaccine on the whole. That with Pfizer vaccine having a 3-day storage life, there can be some logistical issues in terms of ensuring that any vaccine which isn't used actually is used within its short life, because the waste of vaccine is obviously something that would be a bit of a disaster given the current state of affairs. What I also like to say is general practice, although we are certainly prioritising our work in terms of the deployment, general practice is at the moment, and we strongly, push for the fact if patients are needing for any care, routine or urgent, that they contact their GP, because services are still open. We're still referring patients to hospital. Yes, there's some things, for example, I do minor surgery, and I haven't done that for a while, but on the whole, all services are open, so that still is the message from general practice to patients. I'm very happy to take any questions on how the GP experience on the cold face is, and thank you for listening.
No, thank you very much. It's very useful because obviously GPs are dealing with people firsthand. I know that on this issue, so thank you so much. So, Sandra, can you give a quick update as well? Then we'll open it out to questions from the committee.
Sure, thank you. From a social care perspective, I would echo Richard's statement about the joined up piece across Hillingdon in terms of working with GPs, with the CCG, with the hubs, to enable us to be able to send out appointments for social care staff, which we have estimated, and I have to tell you it's quite a challenge to count the numbers of social care workers across Hillingdon, because they range from paid employment by the council to contracted by the council to privately contracted and privately funded workers. And the JCVI cohorts are very clear about anyone in paid social care should be included in this cohort. So we're currently working on a number around 4,600 workers, and our target from the beginning of January was to ensure that we made sure that every one of those workers was invited for a vaccine. And I can tell you that as of last week, and certainly today, that is fact that has happened, and we're really proud of the fact that every one of those people that we have found and known about, and we really have gone out and tried to find everybody, because there's many people that employ paid carers to work for them that don't come into social care's knowledge. So it's been a search, and we've done that search. We have in the region of, and again, you start with the denominator, which is your original number, and it very much fluctuates around social care and around the availability of some of the Pfizer vaccine. So we have vaccinated in the region of 2,500 social care workers to date, and that number increases every day. We certainly do have a reluctance in certain cohorts of staff that are predominantly stating that they're waiting and seeing and would like to see how the vaccination programme is rolled out, and others to go first. And we are working on the premise that we're giving staff choice, but we're going to promote the option to at any time come back and get that vaccine done, and that will continue. So we have a cut-off date of the 14th of February to make sure that we get as many people in those 4 cohorts vaccinated in the beginning, but that doesn't stop for any of those people. We'll continue, and there will always be an open offer to those staff to go back. And then just finally, with Richard's teams of local, so CNWO and other colleagues across the piece, managed to vaccinate almost all willing and participating care home residents. So all care homes have been vaccinated, with the exception of one. There was an outbreak situation, and that actually will be finished tomorrow. So, and Hillingdon is ahead of the curve in terms of they've also vaccinated their registered care homes for learning disability mental health users, and the staff uptake has been reasonably good. So I would say 2/3 of the staff, which again I would say is higher than colleagues across North West London, and we're again doing mop-up sessions to ensure that those people and many are changing their minds, which is really positive. And tomorrow we'll be holding a social care staff webinar that will invite social care, or the staff have been invited to pose questions for professionals and for GPs and public health officers to be able to reassure them and really give them the freedom to make the choice. I think that's our priority at this moment in time.
Thank you, Sandra. Before we go into questions, I'd like to minute the fact that we appreciate the effort of all the agencies involved in putting together what has been the biggest logistical challenge that we've faced since World War II. So when something happens so big and so quickly, it's funny to think that none of that existed 3 or 4 months ago, which is absolutely incredible. So I think we should note that it has been an absolutely incredible journey so far. So before I ask others if they want questions, I'm going to take chairman's privilege, and I'm going to ask 2 questions myself. My first question is around location of vaccination sites, and this is partly related to the NHS letter that was sent out to the original cohort. I have personal experience of this from my sort of relatives, and when you read the letter, you went on, you had a link, and you got offered a choice for a link in Wembley. Now Wembley, of course, isn't that far in some ways, but is far in other ways, and so a lot of people, especially in that cohort, were a bit nervous about going all the way to Wembley. It didn't seem clear to some people necessarily about what to do in that situation. Now, I noticed that more and more vaccination centres opening. For example, where I live in Eastcote, the Eastcote Pharmacy now has a big sign outside saying vaccination centre, which is absolutely fantastic. But what I wanted to know is, are people going to be offered more local options in the first instance?
Shall I take that, yeah, Chairman? So the short answer is yes. We are actively looking at more pharmacy sites, and we also, of course, are awaiting the opening of the 3 mass vaccination sites equivalent to Wembley. I think, as you mentioned, the enormous logistical challenge, and I think that if we have to do this again, and when we get into the second round, I think we've learnt lots of lessons as to the approach that we would take. Of course, the launch of the vaccination programme was a national programme driven by national policy, with national approval of local sites being put forward. And I think that had enormous strengths, but I think it did have disadvantages in terms of really making the local sensitivity of geography that we would expect. I think the other thing just to bear in mind is that at the start of the vaccination programme in the middle of December, for a start, we were talking only about one vaccine stock, and of course now we're talking about two. And at that time, we were talking about relatively limited and unpredictable supplies of vaccine. And I think Hillingdon was in the position of having two primary care sites rather than three, as in some other boroughs. And as you mentioned, no mass sites within its borough. And in some ways, that was just as well, because I think what would have been worse would be to have a mass site that was open, but without either the stock or the staff to run it. But the short answer to your question is yes, there will be more sites planned.
Fantastic. Obviously, the answer to this question is you can't tell us, but how imminent are the local mass centres from being open, or how imminent do you hope they will be open?
I mean, I've seen dates for each of the three towards the end of this month, so I am hoping that will be February. But let me get specific information, Chairman, and let Nikki know that.
Thank you very much. I understand this is a fast-moving situation. And my second question is really about the statistics for the local area. So obviously we have, I mean, you probably would have picked up the local paper this week had a big headline saying North West London's terrible at vaccination programme, and then London political news on BBC, I saw a local MP, David Simmons, on it, but they were saying, you know, there's complaints about London being slow X, Y and Z, but obviously the stats you've talked to us tonight are actually really very positive. And when I sort of go to residents associations and all this sort of stuff, even though it's not direct council business, this is one of the things that most people care about. It'd be really useful if for me I could have statistics like that to say actually things are better here, because or things are good here, and it's in that, because obviously I think it's a really good thing, but a lot of people I talk to are very keen for people to be vaccinated. So I wondered, is there any way that we can have more public local statistics around what's happening in Hillingdon released?
Yes, we certainly can, and we've been sharing figures with officers, and we'd be very happy to do a pack for this committee. I think, again, as Sandra mentioned in her presentation, I think part of the issue is that the official data is that owned by the national database, and so inevitably there is some delay in getting yesterday's vaccinations fed through to the database. But I think Hillingdon, I think North West London should be proud that we are vaccinating more people more quickly than the rest of London. And I think Hillingdon should be particularly proud because I think we are vaccinating more people and have done so more quickly than elsewhere in North West London. We could break that down in specific age groups for members. So Hillingdon really is up at the top of the tree across London.
I mean, that's great news, and that's news that I'd love to shout from the top of the rooftop. So that's really good. Thank you. Okay, I'm going to ask for other members of the committee to indicate if they want to ask questions. I've got June and Ali already down. So who else would like to ask a question on this topic? Nikki, you might need to help me if anybody's raising their hand.
Councillor Harangi.
Devi, Vanessa. Okay, I've got June, Ali, Devi and Vanessa, so we'll start off there. So June, would you like to ask a question? If June isn't
Councillor Nelson, we can't hear you.
Sorry. Can you hear me now? Thank you.
We can, thank you.
I'd like to put this question about the vaccine in Hillingdon, because you said Hillingdon is doing very well in getting their residents vaccinated. My concern is some of our residents have contacted us in regards to people who is unable to get to the vaccination centre. Since there's only two, there's one in the south and one in the north of the borough. Some residents, especially those who who is unable to use public transport. Is there any consideration, or are you considering getting those people who cannot get to the vaccination center, you will be doing any mobile or taking it to their homes so that they can have this vaccination? Because we have had a lot of our residents calling, sending us email to say there is no vaccination center locally where they can be able to go and get vaccinated without having to do a long trek. And some of those people are unable to get out of their homes, especially the elderly. So is there any provision being made for those people who cannot get out and about to be vaccinated in their homes?
Shall I answer that, Chairman, and Dr. Suri may want to add something. So the short answer is yes. Patients who are registered with our practice as housebound and not able to leave the house, the vaccine is being brought to them by CNWL and other staff. We are obviously trying to get more sites available to improve access, as you say. But what we've also been talking to practices and to Health for All and to a number of other agencies is making available either free or reduced cost transport to the vaccinating site. I mean, I think in my experience, most patients are very keen to get the vaccine, and obviously their family members are very keen. So most households are able to sort it out. But in particular cases of need, yes, there are things that the surgeries can do to help them.
Dr. Suri, would you like to add to that?
Yeah, so just like I mean, from a GP point of view, there's no better feeling than giving our own patients the vaccine. From a personal satisfaction point of view, that would be fantastic. But just from a logistical and in terms of rolling out the vaccine at population level, we feel that the current setup works very well in terms of being able to administer the vaccine efficiently. Obviously, we do have CNWL in place for patients that have difficult access. And again, as I said, GPs, practices, doing it for their own patients would be great. It's just, I think, on a logistical basis, the Federation of GP practices delivering the vaccine on a population level, and CNWL addressing patients that have access issues, I think is the way forward currently to ensure that enough patients can be given the vaccine quickly.
Thank you very much. Debbie, would you like to ask the next question?
Thank you, Chairman. My question is that, assuming there is now talk that a new coronavirus vaccine will have to be administered every year, which fits the strain as it changes, where frontline vaccine givers are, noticing problems or coming across just suggestions or ways that the process can be made more efficient, is there an internal communication channel by which those suggestions can be fed up through the system, so that if we're repeating this every year, the efficiency of the whole process can be improved as we move along?
I mean, I think that's a really good idea. I mean, I have to say, locally within Hillingdon and with primary care, I think most of my time for the last 3 months have been taken up about the vaccination programme. We're talking to each other all the time and talking to NHS England. But I think what you're suggesting about collating all those good ideas and best practices is a really good one. I mean, I think as we all know, and as Dr. Suri has just said, general practice has been vaccinating patients for flu and of course all the children's immunisations for years, and it is something that is smooth and automatic. And if we are getting into a situation where we foresee regular COVID vaccinations, I have no doubt personally that it will be administered through GP practices and community pharmacies in the normal way, just as with flu. So I really hope that, as you say, we will learn from the lessons and get it much more smoothly for patients' benefit in the future.
Would the other two guests want to comment on how communications and how this has all worked?
So yeah, Dr. Suri here. So if I can go next, that's okay. So we have a dashboard where we can view which patients have taken up the vaccine and which haven't. So, for example, there are cohorts of hard-to-reach patients, Black and ethnic minority patients. Also, we foresee with the move to the next cohort for the vaccine in terms of patients between the ages of 16 to 64, with underlying health conditions. We potentially may have a group of young patients who are vulnerable and have significant comorbidities, potentially also being a difficult access group. So we do have channels to feed back to the Federation with any issues that we feel with the current flow. So GP Federation is the provider who's responsible for delivering the vaccine, and all practices in Hillingdon, bar 2, are members of the Federation. So yes, a more formal route for issues and concerns, I certainly agree, would be a good thing going forward.
Thank you. Sandra, do you have any comment on this from your experience?
Just to add to Richard and Dr.'s comments, we have a health protection board that meets monthly with all partners. So all partners are involved, including Health Watch and colleagues from Hillingdon Hospital. And we also have a comms working group with North West London, which looks at the lessons we learn, how we can promote the vaccine in the priority groups and the uptake. And we can look at very focused and targeted work with our community champions. So there is communication up and down the system that is really captured, I think, really well at this moment in time. But for me, as a provider of care services across the borough and working with vulnerable people, we do vaccinate, and consent is a big issue. So we do vaccinate vulnerable people every year for flu. And I see this as an extension, once we have the mass vaccination programme completed, that this will be an extension of the flu vaccination programme going forward. As with all residents, but certainly with social care users, we will be continuously mopping up with new starters in recruitment, with people that have changed their minds, etc. So we'll continuously be vaccinating throughout the time. And I think that there are very good open channels, including through public health, actually, to be able to communicate where there's any bumps in the road. And there has been a lot, but we are able to work through those and, as Richard says, deliver the vaccine to a huge amount of people in the last 4 weeks.
Thank you very much. Ali, would you like to ask the next question?
Yeah, thank you, Chairman. I've got 3, but they should be pretty quick, so I'm not going to take too much time. The first question is really a question about supply. There's been a little bit of a worry now that we've done having a fantastic start, that supply might become an issue later on to get past Group 4. So I just wanted to know if there were any anxieties from this group as to whether there was an issue with supply of the vaccine. The second was just a quick question about antibody testing. I know a lot of the government is kind of looking into antibody testing and rolling it out in some places following vaccinations to see how long it takes for antibodies to kick in and to give better advice to local members. So I wonder if there's any of that going on in Hillingdon, or whether that's all centrally controlled and not to do with Hillingdon. And then the last question I had, both statistically and from the doctor's anecdotal experience, how is BAME uptake? There's a lot of misinformation out there through WhatsApp chain messages and all sorts. And I think a lot of us have done really well, including this local authority, MPs all over, across the parties, to try and combat it. So I wonder how BAME uptake is going on in Hillingdon when it comes to the vaccines. Thank you.
Shall I answer the supply question, and then perhaps Dr. Suri and Sandra might want to talk about testing and the BAME. So on supply, I mean, I think right now we would welcome as much supply as we can get, and we keep pushing National to give us more deliveries. I think I've heard a rumour that supplies for next week and the week after may be less than over the previous few weeks. I have to say that I've heard those rumours over the previous weeks and they didn't prove to be correct. So it may not be as bad as we fear. But I think the important thing is that we are already ahead of the game. We are bidding for as much stock as we can possibly get, either from elsewhere in London or elsewhere within North West London. And we'll just keep pushing. Dr. Suri, I don't know if you wanted to say anything on testing.
Yeah, I completely concur with Richard. So from GP's view, we've had no issues in terms of booking into the Ruislip site. Occasionally, the Hayes site have asked for provisional because it's usually just awaiting confirmation of supplies. But largely these have come through. So there haven't actually been a hindrance that we've noted to our patients getting the vaccine. Now, on the 2 points regarding BAME groups, so in our practice, we do have a large South Asian population. Personally, we haven't actually experienced low uptake in our patients from of South Asian origin. However, colleagues in neighbouring practices in the South Wards have reported this. Some of the things that GPs are doing, so there's been videos that GPs have created in different languages to try and dispel some of the myths that have been unfortunately going around on social media regarding the vaccine. Also, as mentioned before, we get notified when a patient doesn't book in or DNAs, and so GPs are doing a lot of work contacting those patients to try and have a bit of a better understanding of why of the fears of the vaccine, so they're better informed and not uptaking it on misinformation. And regarding, sorry, the line went a little bit fuzzy, but I understand the question, was it regarding antibody testing and how well that's being rolled out in Hillingdon? Was that the question? Sorry.
Yeah, on antibody testing, but also specifically antibody testing after someone has had the vaccine, to be able to tell at what point the antibodies kick in, and basically give better advice on taking the vaccine.
Okay, so antibody testing was rolled out. This was primarily for staff, and this was earlier on last year. In essence, it hasn't proved a huge amount of usefulness. It just told us whether members had contracted COVID at some point, and we also don't know exactly how long the response is and how long antibodies stay. In terms of rolling out antibody testing post-COVID vaccine, this is something that I'm not aware of. It's not something that's happened to any of my patients. I don't know if Richard has any more information on that regarding on a population scale, but locally I've got no knowledge of antibody testing post-COVID vaccine. At the moment, we are really putting all our efforts to make sure that patients have their first dose. I don't know if Richard wants to add anything on to that.
No, I've got nothing to add to that, Dr. Suri.
Thank you. Sandra, I was just thinking, obviously, with the BME question that was asked as well, and you mentioned the Community Champions Programme and also general sort of, public affairs work to deal with disinformation. I mean, could you sort of expand on what the Community Champions Programme is and how it sort of works to get the message out there?
So the community champions are currently working specifically actually with colleagues and members of the community in the south of the borough. And that is in relation to the data that we're aware of in terms of the uptake of the vaccine across the south of the borough for a whole host of reasons. That would also include things like the uptake of testing. So we have the lateral flow testing site, which is a 30-minute rapid testing site in Hillingdon. We have the PCR testing site, which is a confirmatory testing. And the uptake in that part of the borough has been particularly low in terms of the vaccine uptake, in terms of the testing uptake. A whole piece of work is being done by the community champions, and the community champions lead Fiona Gibbs with local faith leaders, with the police in terms of enforcement, and with others to try and generate an understanding of what it is that's blocking people from accessing both prevention and in terms of the testing and monitoring, and then prevention in terms of the vaccine. So they have just started their work. They've hosted a webinar with faith leaders today, and there's another one on Thursday, and they will be publicising. And we are working with the Confederation in terms of publicising some leaflets in languages that people such as home carers can take out when they are visiting older residents or people with disabilities in the area, to try and ensure that they've been reached, because they're not always using social media, and making sure that they've got all of the information that they need to help them make decisions. So it's a very positive and active campaign that includes things like ensuring that we supply PPE down in the area to local groups that are struggling to support local residents. So there's a whole programme of activity to try and promote good well-being at this moment in time, and that's in conjunction with all of our colleagues.
Thank you, Sandra. And I understand, obviously, this has just sort of started. So if I take Chairman's liberties again, I mean, I wonder if for our next meeting in the middle of March, before then, just a written update, nothing too detailed about how it's going, because obviously you're learning so much at the beginning. So it'd be really, I'm sure we're all going to be really interested to see how that's going. Thank you very much. Vanessa, would you like to ask the next question?
Well, yes, except my question's already been asked, and it was about particular members of the particular community groups not taking it up, and then what's being done about it. So I think it's been discussed. So no, and actually having an update next time would be really good. So no question.
Great minds. They're great minds.
Efficient teamwork.
June, did I see that you had your hand up again? Would you like to ask another question?
Is that me?
Yes.
No.
Okay,
no.
Sorry. Yeah.
Councillor Milani.
Okay, yeah, Ali, can you raise? You can ask a follow-up question. And by the way, for everyone else, if you want to ask a question, please raise your hands in the next couple of minutes. Otherwise, we'll end this part of the session. So, Ali, please ask your question.
Brilliant, thank you. I just it just came into my mind as we spoke about the lateral flow testing. I'm a little bit concerned that the information isn't as crisp as it could be. in regards to lateral flow testing, because I think the data has shown that it misses nearly 50% of COVID cases. And the worst thing that we would want to do is have someone take the lateral flow test, get a false sense of confidence with a false negative, and then take the disease to their parents or their grandparents. And so is any work being done? I know the BMJ wrote an article about this recently in regards to only 1 in 3 local authorities were providing this sufficient information. So I wondered if there's any work being done to just make the communication on lateral flow testing a little bit crisper and cleaner, so residents have all the information they need.
Yes, that is a very important communications issue, because we don't want people getting the test and thinking they're okay and then running out into the streets and hugging everyone. So yes, who would like to answer that question?
I'll take part of it if that's okay.
Yeah.
In terms of the communication, I can certainly take that back to the lead in Hillingdon around lateral flow testing. So if I take it from a social care perspective, using lateral flow, it's a very helpful tool for managing day to day. And I think that you're right in terms of the communication about that. So what we want key workers to do in terms of social care workers to do is to know their current position that day. And in the main, lateral flow testing tests for infectiousness, which is what we really need to know. We need to know if somebody is infectious. If they then test positive on a PCR test a couple of days later, often people will say, well, the lateral flow test gave a false reading. Almost all positives from lateral flow we find go on to test with a PCR test as positive. So the positive tests working very well. The missed negatives, I can't quote you on any data in relation to that, but we're very aware of it. So there is a regime, a very strict regime in terms of very vulnerable people, where staff are testing twice a week with a PCR test and twice a week with a lateral flow test. So you're getting a really good quality assurance reading. And in a lateral flow testing centre, they are required to do follow-up PCR tests as a quality assurance every week. So there is a clinical oversight, and they're checking that the results that they're getting from the lateral flow are one level of quality assurance. So I understand your point in terms of it's 50 or 60%, I think, in terms of the accuracy. At the time that lateral flow was rolled out and developed, 60% was a really, really good step towards knowing the general population status within a few minutes, and being able to take that person out of that situation if they do test positive very, very quickly is really helpful. For instance, a care home worker going to the front door, doing their lateral flow test, or even now they do it at home, do not step into that building. So it's a very useful tool used in the right way with the right quality assurance and clinical oversight.
Yeah, no, thank you very much. Okay, so
Chairman, it's
yes.
Councillor Graham here. I've raised my hand, but I don't think anyone's seen it.
Okay, no, that's all right, Ray. Go for it. What would you like to ask?
Yeah, but just quickly, a question I'm asked frequently: can it be assumed that the local doctor's surgery will advise when and where the second vaccine dose will be given? Is my question.
So, from the patients are given a card once they've had their COVID vaccine, the first dose. Their appointment is booked for their second dose on their card. So they'll be given a card which vaccine they've had, and there'll be an appointment that is booked for the patients for the second dose. The government guidance is 12 weeks. What we tell patients is when they will be called, similar to the first dose, they will be called as summoned, so to await being contacted rather than contacting the practice chasing dates. because this can actually, unfortunately, block up phone lines. I don't know if Richard has anything to add further to that.
No, I don't think so. I mean, you're absolutely right, Councillor Graham. Patients at the time of receiving the first dose need to be told when the second dose is, and of course where to go, and that's the line that we're taking. Were you concerned from specific individuals, or had any complaints been raised with you, or?
No, it's just that
Yeah.
one or two people over 80 who've already been vaccinated have asked me the question. So you've provided the answer. Thank you.
May I just add
Yes.
that the national booking system has now been updated. So people that were in the early days of the vaccine, so over the last 4 weeks, will have to book another appointment, and they will be supported to do that and called by their practices. However, the national booking system now allows, when they make their appointment, it schedules your second appointment. You can choose the date and time, but it takes you exactly to the 12-week point where you need to book that appointment. So it's very straightforward and simple now, and means that they're all scheduled in.
Yeah, no, I've had that experience actually, where for somebody, elderly relative of mine in the borough, they automatically were given their second date, so at some point in April. Okay, thank you. So I'm going to draw this bit of the meeting to the close. I think I've picked up 2 action points, and Nikki will correct me or add some more if I've missed any. The first one is Richard's going to get back to us with some statistics that we can sort of share publicly, which would be really useful about Hillingdon, because the information, we want to get it out there, especially as North West London stuff isn't so great. And the second action point is, before our meeting in March, Sandra will provide us with a written update of how the communications and the Community Champions programme is working, because we'll be interested to see about that. So, Nikki, have I missed any actions from the meeting?
There was one other issue. Richard was going to provide further information about the opening of maths centres in Hillingdon.
Yeah, I've made a note of that.
Great. Excellent. So if everybody's happy with those being the actions from this part of the meeting, I'll take silence as being, yes, that's okay. Okay, well, thank you very much to our 3 guests who have joined us. That's been really illuminating and interesting on something that's so important and lots of people are talking about. So thank you very much. So you can stay if you wish to, but you're very welcome to leave the meeting as well, because we're going to move on to talk about local post office services. So
thank you.
Okay. Chairman, sorry, can I just ask, the GP pressures review, I understand, is a bit later on in the meeting, so I'm very happy to hold on or rejoin, whatever you feel is most appropriate.
I mean, if I know Laura has joined, if Laura's okay, are you okay waiting for maybe 10 more minutes before starting, as Dr. Suri is here? Where are we? Yes. I did see Laura joined. I don't know if you're listening and your mic's off, or if you've gone off to make a cup of tea, which you're very much allowed to do. As Laura isn't speaking at this moment in time, should we cover that agenda right now, just so you can get away properly? So that's.
I'm very flexible. Whichever works for yourselves. I'm very flexible.
Well, I'm happy as Laura isn't. Sorry, Laura, if I'm speaking and you are trying to speak. It's one of these things about technology, isn't it? But I'm very happy to go with it, because I don't think it'll be a very long agenda item. I might be wrong. So, and which is agenda item 8, isn't that right, Nikki?
That's right, Chairman.
Fantastic. That's ultimately an important part of being a chair's job, being able to read the agenda. So that's good. Okay, so yes, in terms of presenting this item. I mean, Dr. Suri, would you like to say a quick few words about it first, and then we can take any questions if we have any?
Sure. So, from the recommendations of the GP pressures review, one of the recommendations was streamlining liaisons with social services, particularly around letters, and we're trying to reduce the administrative pressures on GPs, where we really feel we want to be seeing and treating patients rather than writing housing letters, for example. So we did meet with the housing department, and we did agree a process of how to best streamline referrals and letters for socials, for things such as blue badge, all the way through to housing letters and benefits. The other thing is it will be benefit for patients, so they're not, circling in the system. We had agreed a process. However, because it was also deemed regarding payments, which was responsible to CCG, so we passed it on. We felt that it's better. CCG was better placed in terms of deciding funding for such work. Going from that to other recommendations such as training and GP training, and trying to increase the workforce, particularly in the south of the borough, where pressures were very high due to ranges from social deprivation, but also challenges in recruitment of GPs. So Health Education England did approve there to be some sort of cycling of trainees, so that more trainees had had more exposure to working in the south of the borough. Traditionally, we've got 5 practices in the south, which is the minority of practices. So, unfortunately, trainees go where they feel that they've got experience. So that was one of the reasons why the south was finding it challenging to recruit. So there's been more flexibility in GP training to allow more exposure of trainees to the south, which is certainly a good thing. Now, in terms of due to COVID, unfortunately, the work on the GP pressures review has been suspended because of priorities with COVID, ranging from obviously continue with essential work, but also providing support for vaccinations. So, because of other priorities, some of the recommendations of the GP pressures review have been put on pause.
Yes, no, thank you for that. And to be honest, I look at the front of this paper and it says the review was considered and recommendation agreed by Cabinet on the 3rd of January 2020. Oh my, what a different world it was on the 23rd of January 2020. So my initial thought reading this report is that the recommendations are moving forward well, considering, and ultimately it'd be really useful if we had another report on this in a year's time. We obviously with all the pressures that you've talked about, so we can get a true reflection of how the recommendations are going. Does anybody else have anything to add on this agenda item? No. Oh, excellent. So I think we can move on back to the post office agenda items. So thank you very much. So, Laura.
Thank you very much, Chairman.
Thank you very much, Chairman. Thank you, colleagues.
Laura, are you here?
Chairman, Laura appears to have gone.
Ah.
Okay, do you want to move on?
Yes.
To the work programme item, yes, and see if she comes back.
Yes, yeah. No,
oh, she's come back. She's back.
Oh, hi, Laura, are you back?
Hello, can you hear me now?
Yeah, brilliant.
Fantastic.
I feel like I'm in some sort of 1980s Eurovision Song Contest judging thing when I do this sometimes, and people drop off and everything like that. But anyway, excellent. You're back. Well, thank you very much for being patient and waiting for us to finish the health agenda items that we had. So thank you very much. So yes, about a year ago, I think it was about a year ago, or maybe even a bit more. Time is just so strange at the moment, but we had a really good evidence session with the post office talking about the needs and how they would be met in the post office strategy. And I think it was a very good discussion from both sides. So we thought it would be useful, and thankfully you thought it'd be useful as well, to come back and maybe give us a bit of an update on where we're at on all this sort of stuff. So would you mind giving us a quick talk about basically what's happened in the last year and things that you think you should highlight to us?
Yep, that's absolutely perfect. And thank you very much for inviting the post office along to your meeting. It's really helpful to be able to explain to people about what's been going on in the post office. So as you know, it's been a very extraordinary year. And for retailers on the high street, there has been quite an impact. It's been quite a difficult year for retailers. You probably know that the majority of post offices are partnered with a retailer. So therefore, whatever they're feeling, we're feeling too, as it were. So the post office hasn't been immune to the effects of the pandemic. And obviously customers are changing a lot in terms of how they shop. There's more people shopping online nowadays. That's kind of the change there has been pretty rapid. So in the last year, the post offices are deemed as an essential service, and we've remained open. And importantly, we've been providing those essential services throughout the pandemic. And currently, we have 99% of post offices that are open for business. So that's a really good positive result for us and for our customers as well. However, there has been a small number that have been impacted by the ongoing effects of the pandemic. So we are seeing some branches where there's been disruption to services. So they might have a temporary closure, they might have reduced opening hours as an example. So, and that's usually due to staff shortages. So you've got people who work in branches who might have to go shield, so they might not be able to come to work. They might be unwell, they might be going for testing, that kind of thing. So, and these disruptions are often at very short notice, unfortunately. So sometimes a branch might, you might see your regular branch and be visiting it every week, and then the following week that there might be a change in the opening hours, as an example. All of our customers have been really kind of positive and supportive of post offices as well through this period as well, and have been quite understanding about, the disruption and impact that it's had on some of the branches. In terms of trade, it's been quite mixed. So we're seeing some branches that are seeing an increase in transactions. So things like people sending parcels and mails has really increased as more people can't see each other. So they're posting things, especially at Christmas as well. That was one of our busiest Christmases ever, as more people were encouraged to stay at home and post their gifts to families. More people are also working at home, so they might be using their local post office like they didn't do before as well. So we are seeing a different kind of trend in how people are using their branch. On a different note, we are seeing people not buying things like travel insurance and foreign currency, as you'd expect as well, because less people are going on holiday, and those are very important income streams for the post office. So it's something that we do need to be mindful of as well. Post offices are the place on the high street for banking services, and lots of people, lots of individual customers and small businesses do rely on us for their banking services. And in December we saw the highest amount of cash withdrawals over the counter, which equated to £640 million, which is absolutely amazing. Lots of people aren't using cash in shops, but actually we are following and tracking the use of cash throughout the UK, and we are seeing obviously peaks and troughs in terms of usage, but actually December was a really positive month for cash withdrawals. So in the past year, our focus really has been to support our postmasters and to make sure that our operations within the post office and our branches are able to provide those essential services to our customers. So we've provided things like PPE to branches, fitted perspex screens in post offices. We've guaranteed remuneration for postmasters over a few months because we were obviously seeing less people coming into branches, especially in the early part of the pandemic in the first lockdown. We also set up a hardship fund for postmasters who might need that bit of extra financial support. We've got posters in branches that we've given to postmasters, so to encourage customers to wear a face covering, to practice social distancing, and to practice good hand hygiene as well. I must say our postmasters and their teams have worked extremely hard in this past year. It's been a very challenging time for them. A big thank you really to the postmasters of Hillingdon, who some may be listening, who knows, but a big thank you to those people. And in the area, in the Hillingdon Borough, there are 26 post offices that are open for service. Some of these may be subject to some of the disruption that I've already mentioned around, people with reduced hours and maybe having a temporary closure because they've got to do some deep cleaning or there's staff shortages. But on the main, it's been pretty stable in terms of service provision across the borough.
Thank you, Laura. I'll ask the first question and then I'll open it up to other committee members. I suppose over the last couple of years, the sort of strategy has been moving from sort of the Crown Post Office service to agencies essentially, and shutting the big relatively on whatever high street they're on buildings and partnering up with somebody else who's already there, and use agents or other similar types of shop. And that certainly, there was a bit of a worry at the time. Obviously, will the service still be provided in the way that it should? And I think in general reports have been positive on that, and obviously you have provided statistics about how you're meeting your the standards of essential service that you need to provide. I mean, is there any inkling of if any changes in the future are going to happen? I mean, is technology going to be used which might threaten the high street post offices, for example? I mean, it's not, I know it's not the same, but we see it with banks, for example. Lots of banks are now shutting even more so than they were before on high streets, and in many ways the post office has been one of the linchpins during this time, and certainly one of the places which has the biggest queues outside it. So I do think it is still appreciated locally. So, I mean, do you have any sort of view about where the post office's strategy might be going?
Yeah, so you're absolutely right. I mean, our aim is to maintain a network of 11,500 post offices across the country, and that is still our aim. And actually, what we would like to have is more post offices. So we're not looking at cutting services, but what we are looking to do, and I think one of the things the pandemic has shown is that people's shopping habits have changed dramatically, and how do post offices keep up with that really and remain relevant to the communities that they serve. So there is some work going on at the moment to look at how best post offices can serve their communities, where are the best locations for them as an example, and what kind of services would they be selling. So, I'm not proposing there would be any kind of real dramatic changes here, for instance, but there is a review going on at the moment. And as with any business that is going through, the changes that have been enforced really as a result of the pandemic, we'll be looking at their operations and looking at how they can improve and make, the best for their customers and their postmasters as well.
Is that a public review, and can people like us feed into it if we wish to?
It's not a consultation. We will be obviously discussing it with our government department bays. So, and when we do have any kind of confirmed plans about what that might look like, we would obviously make that public. But it's not an open consultation as such, no.
Okay, not yet anyway. So okay, well when we get public, I'm sure we'll have some views. So thank you very much for that. June, I saw that your hand was up.
Yes, I'd like to ask a question about not the last report we had about the post offices. We're going to look into see if any of the businesses will uptake opening up a post office in the Heathrow villages, because there's no post office facilities in either Sipson, Hammersworth, or even Harlington. And is there any update on whether any of the businesses has taken up that offer?
From what I understand, those two particular areas, the Sipson and Harmondsworth areas, they're subject to Heathrow expansion. Is that right? So therefore we
eventually.
Sorry, could you say that again?
We hope not, but potentially. So
okay.
But
So
just clarification on that. It's potentially yes, but they were going to look in to see whether any of the businesses was going to be able to take up that offer, because we did have post office in Simpson and in Harlington, but both is now gone. So they were going to come back to us to tell us or let us know whether they have approached the businesses to see whether they will take up the offer of reopening the post office.
Okay.
Yeah, to build on June's point, I mean, one thing I do definitely remember from that meeting is one of the issues was that when you have you go out, you do your agency thing, there is a certain timeline that people have to sign up for. I can't remember if it's 5 years or something like that, and that was a big barrier for businesses in that area wanting to sign up to do an agency post office, because who knows where they would be in 5 years' time. So I think one of the things that we suggested is, in those sort of extreme circumstances, would it be possible to make the offer more palatable for local businesses?
So there are some contracts where there might be a longer commitment, but generally there wouldn't necessarily be that longer term. But the issue is really around whether post office and the retailer want to invest in a new part of their business when they have an uncertain future. I think that's probably the bigger question. And for that, you'd need to kind of ask the retailers in that area as to whether, they have a long-term plan. And if they have, is the post office part of that, really? Because if we open post offices, there is obviously a cost to the post office, which, is often taxpayer funded. And also with the retailer, they'd be looking to invest in their own business as well, because they might need to make changes and adaptations, etc. So when there is something like this that is on the horizon, or, obviously I don't know exactly what the future is, and you probably know more than me, it does create an uncertain situation, and therefore it's more difficult to provide local services when there is, the concern, I suppose, of what is the future for that in that area.
Stuart, you've got your hand up. Would you like to ask the next question?
Thank you. I suppose I wondered if there was any ways in which the local authority could work with post office and local businesses to eradicate some of those barriers. Sorry, hang on a minute. The cat's not a fan of the soup.
Sorry, a non-voting member, so it's
because if it is around, people worrying about a loss, if there is a way in which council could underwrite or work with, because we don't know the future of the third one. We all have a hope around this committee, of which we would like to see it go. But in my mind, short term could still be 5 years, which could be viable. And I think in an area where right now, these are remote-ish villages that are sitting in a pandemic where there's already access to services limited. It's a priority area, in my thinking, for those who really need these services, particularly if we're talking about banking and other such services. So it would be useful if we could get a commitment from Laura and others to have an ongoing conversation about how the council can troubleshoot some of this alongside businesses and the post office.
Yeah, I mean, absolutely. We do really want to work with local communities and obviously look at maybe some of the constraints that we have, and also that the retailers might have. And if the council can support that in any way, then that would be great. So we would happily do that. Yes.
I think, Laura, in a sense, if you could, not necessarily in this meeting, but maybe at some point later, give us some ideas about how we could help. I mean, I think that would be useful as well, because we do want a post office in that area, and we it's but we don't really know the mechanics of it all completely. So any ideas that you have would be appreciated.
Yeah, I mean, currently at the moment, as I say, this year has been focused very much on supporting our existing branches and our current postmasters through the pandemic. So post office has put a huge amount of investment into things like PPE and guaranteeing remuneration for a few months for postmasters. So that's a big cost to us at a time, when some of our income streams are lower than what we would have anticipated for the year. So at the moment there isn't funding available to support new post offices at the moment, but there are opportunities perhaps in the future where we look at new types of branches and perhaps they are lower cost type models and that kind of thing that might be more attractive to retailers as well. But absolutely, we're more than happy to work with the council, but I think the key things are, it's about having somebody who wants to run the post office. It's about having the premises available to run it in a sustainable retail environment, because those are the key things that you need to run a post office. And then, of course, you need the funding to be able to set it up. So those are the kind of the key things that we are looking for.
Thank you. I can't see any other hands up at this moment in time. So if no one else wants to speak, I'll draw this item to a close. First of all, thank you, Laura, for joining us to give us this update. And of course, I think in the future, if more change is going to be happening after reviews happen, all this sort of stuff, I'm sure we'll be interested in this subject again. Also, if there are any changing circumstances where you think there may be a way you could support or support the opening of a post office in the sort of Heathrow Villages area, then obviously please do update us, and that would be much appreciated. So, absolutely, thank you. That's okay. So I think if everybody's happy, we'll end that agenda item. And thank you, Laura. You may go. So.
Thank you. Bye bye.
Bye. Right. So looking at my agenda. Yep. So we have one more agenda item. Oh, sorry, I thought I was on mute there. Well, I wasn't. Fantastic. One more agenda item, which is the work programme, which shouldn't be too long because we did a lot of work on it last time round. The only thing I want to note is that in the March meeting, we obviously have the police, a police focus meeting. And if anybody has any ideas of issues they want to raise, please let Nikki know within the next couple of weeks, because obviously if the police know in advance, then they're able to prepare their answers. So I'm certainly going to be wanting to hear a bit more about how we've been dealing with the COVID situation in terms of policing, all that sort of stuff, because obviously there's been lots of talk about the complication and regulations, and it'd be useful to know how much fining has been done on how they found that in the area. But yeah, if you have any other ideas and other things you want them to talk about, please let Nikki know in the next couple of weeks. And the other thing I wanted to mention is I thought March's meeting would be a good time for us to have a bit of a brainstorm about what we might want to do next municipal year, because obviously our two meetings in April are going to be pretty intense, and then after May, our first meeting is in June. So I really want to hit the ground running. So it's not for now, but essentially I think that'd be a really good time to kick around ideas about the type of things we want to focus on top of our sort of general remit. So I propose that we add that agenda item to the March meeting. Is everybody happy with that? Fantastic. Okay. Well, so I think that's going to bring a close to this meeting. Nikki, is that okay?
Chairman, before you finish, there was just one other thing about our meeting on the 28th of April. At the last meeting, members agreed that we'd have that focusing on Hillingdon Hospital, so looking at the redevelopment, but also looking at performance. In addition to that, it would be good to have Mount Vernon Cancer Centre update. So having other partners, so Hillingdon Hospital own the site, but there are other partners involved. So if we invite them along to that meeting as well, we can get it all over and done with at the same time.
Yeah, and the reason for that is because the review of future cancer services really does depend on what happens with the Watford and the Hillingdon site in terms of what can be facilitated there. So actually, it meets well together. So yes, I think that's a very good idea. So everybody's happy with that idea? Yes, brilliant. Okay, well, if that's the case, I'll draw this meeting to a close. So Nikki, can you do the closing?
If I can please ask everybody.
Ray has just put his hand up.
Sorry.
No, I was just waving everyone goodbye.
Yes. Well. Just when Nikki shuts the meeting down, if you could stay on for a second at the end as well, I'd appreciate that as well. So you'll get a chance to say goodbye to everybody then, Ray.
Okay. Can I ask everybody to please remain on mute or silent whilst I stop the streaming, please? Thank you.